People spend thousands of dollars on HIFU treatments and walk away seeing absolutely nothing. And the frustrating part, they blame themselves. They think their skin just didn't respond. Or they think the technology is a scam. Neither of those is usually true. Today I'm going to give you the exact clinical explanation for why HIFU underdelivers and what conditions need to be met for it to actually work. Because when done right, HIFU is one of the most scientifically sound non-surgical lifting options available today. The problem isn't the technology. It's how it's being applied. Stay with me, this is going to change how you think about non-surgical skin tightening entirely. What HIFU actually is. Let's start with what HIFU really is, not what the marketing says. HIFU stands for High-Intensity Focused Ultrasound. The key word is focused. Regular diagnostic ultrasound spreads energy across a surface area. HIFU concentrates all of that energy into a microscopic point deep within tissue without damaging anything on the way in. Think of it like a magnifying glass in sunlight. The glass itself doesn't burn your hand, but focus that light into a single point. It ignites paper instantly. HIFU does exactly that, but inside your tissue. And where does it focus? On the SMAS, the superficial musculoaponeurotic system. The SMAS is the anatomical layer that plastic surgeons physically lift and reposition during a facelift. It's the structural support system of the face. When it loses tone, the face descends. HIFU arrived promising to access that exact layer without a scalpel. So can it? How HIFU works on the SMAs. Here's the actual mechanism. The HIFU transducer emits ultrasound waves that pass through the epidermis and dermis without causing damage, then converge at specific depths depending on the cartridge used. 1.5 mm superficial dermis, collagen stimulation. 3.0 mm deep dermis, superficial fat and fibrous septa. 4.5 mm SMAS layer, facial structural support. More advanced systems also offer 6 mm and 9 mm cartridges for body applications. When the energy converges at that focal point, it generates localized heat, around 65 to 70 degrees Celsius in a fraction of a second. This heat triggers what's called controlled thermal coagulation. Existing collagen fibers contract immediately, producing the visible tightening effect patients notice right after the procedure. But the result that actually matters happens over time. That controlled thermal injury activates the body's repair cascade. Fibroblasts, the cells responsible for collagen synthesis, are recruited to the area. Over 90 to 180 days, they produce new type 1 collagen, denser, more organized, and structurally firmer. This is exactly why HIFU doesn't deliver its full result immediately. The real lifting happens gradually, over 3 to 6 months. Why it sometimes doesn't work. Now let's get into the part that actually matters. If the science is solid, why do so many patients see no result? Here are the exact clinical reasons. Reason 1. Equipment that doesn't deliver real energy. The market is saturated with devices that call themselves HIFU but don't have the output power needed to reach the SMAS. No FDA clearance, no verified energy output, they're essentially glorified surface-level ultrasound devices. If the device can't reach the right depth at the right temperature, you will not get a result. That's not a patient issue, that's an equipment issue. Reason 2. Non-individualized protocol. HIFU is not a one-size-fits-all treatment. Cartridge selection, energy density, treatment depth, and shot patterns need to be adjusted for each patient's anatomy, facial structure, tissue thickness, and degree of laxity. A patient with significant subcutaneous fat requires a fundamentally different approach than someone with thin tissue and superficial skin. Copy-pasted protocols produce copy-pasted disappointment. Reason 3. Wrong patient selection. HIFU is not a substitute for surgery in advanced laxity. If a patient has significant sagging that requires surgical intervention and you perform HIFU, the outcome will be underwhelming, not because HIFU failed, but because the indication was wrong. HIFU delivers excellent results for prevention and mild to moderate laxity. In advanced cases, it can be a complement, not the primary intervention. Reason 4. The patient didn't wait long enough. This is the most common and most underestimated reason. The HIFU result unfolds in 3 distinct phases. Immediate, first 24 to 72 hours, slight visible contraction and possible mild swelling. Intermediate, weeks 2 to 6, active neocollagenesis phase. The face may look similar or even slightly less tight as tissue reorganizes. Final, 3 to 6 months, full result with mature collagen remodeling. A patient who evaluates their result at 4 weeks is going to say HIFU didn't work. Clinical education around this timeline is non-negotiable. Reason 5. Reduced energy delivery due to pain management. HIFU is uncomfortable, particularly over bony prominences, the mandible, zygomatic arch, and forehead. When practitioners reduce energy settings or skip shots to manage patient discomfort, they're directly compromising the result. Pain correlates with energy delivery. Energy delivery creates the result. There's no way around that clinical reality. Timeline and number of sessions. The question every patient asks: how many sessions do I need? The honest clinical answer is: it depends. For patients between 30 and 45 with early-stage laxity, 1 well-executed session delivers meaningful results, with annual maintenance. For patients over 50 or with moderate laxity, the optimal approach is 2 sessions spaced 45 to 60 days apart, followed by semi-annual or annual maintenance. Number of sessions is determined by clinical assessment, not a clinic sales script. Patient timeline to communicate clearly. Timeframe: what happened? Days 1 to 3, immediate mild contraction, possible swelling. Weeks 1 to 4, tissue reorganization phase, result appears subtle. Months 2 to 3, active neocollagenesis, the lifting becomes visible. Months 4 to 6, full result. Final clinical assessment. Who is and isn't a candidate? Good candidates. Grade 1 and 2 facial laxity. Patients between 30 and 60. Loss of facial contour definition, jawline, brow, neck. Prevention in younger patients with early laxity markers. Post-surgical maintenance, after medical clearance. Absolute contraindications. Metal implants in the treatment area. Cardiac pacemaker. Active malignancies. Active infections or open lesions in the area. Pregnancy. Relative contraindications. Case-by-case evaluation. Recent fillers in the area, wait 30 days. Recent botulinum toxin, wait 15 days. Active autoimmune disease flare. Dermatofibrosis or impaired wound healing history. Let's bring it all together. HIFU works on the SMAS through controlled thermal coagulation that triggers neocollagenesis. Full results take 90 to 180 days. When it underdelivers, the root cause is almost always equipment output, protocol customization, patient selection, expectation management, or some combination of all 4. If you're a practitioner, your clinical value isn't just in operating the device. It's in selecting the right patient, customizing the protocol, and educating on the timeline with precision and confidence. If you're a patient, before you invest, ask what device will be used, what its energy certification is, and how your protocol will be individualized to your anatomy. If this gave you a clearer picture of HIFU, leave a comment. I'd love to know whether you've had the procedure done or if you're considering it. The link to my complete aesthetics guide is in the description below. It covers everything you need to know before any aesthetic procedure. See you in the next one.